All right. Thank you and happy June, everybody. Thank you for tuning in. It's, wow, halfway done with 2021 already. I hope everybody's doing very well. We are going to talk about neurotoxin today. Most people might know of it as Botox. Botox is one of the neurotoxins available on the market. There are a couple others, and word on the street is that there will be a longer lasting Botox to come. We'll see when that happens and when it will be available to the general public. But for now, let's talk about everything I say from now on. If I say Botox, I mean neurotoxin in general. Okay. So Botox is an injection that I perform in the office. It's one of the most common things I do for my patients. The purpose of Botox is to relax your muscles. So the key word for today is relax. So please like and follow us on Instagram and Facebook, and please text the word relax to our office number, which is here, and you will be entered for a chance to win a free treatment valued at $495. So Botox is a great way to be smooth and stay smooth. The injection that I do is in the office. So the goal is to relax muscles that make facial expressions that we do not like and that make lines. At first, when we move our muscles, and over time, they can set in more permanently. So Botox treatment is done every 3 to 4 months, and the reason that is the case is because after the treatment is performed, the medicine that is in Botox will take effect about a few days later and will last only 3 to 4 months usually. For some people whose metabolism is faster, it might last a little shorter, and if your metabolism is a little slower, it can last a little longer. So in terms of the areas that I like to treat with Botox, there's this area called the glabella, so it's right in between your eyebrows. We might know of it also as the 11s because we make a nice deep line here on one eyebrow and the other head of the eyebrow to make 11s. The other area that we like to treat is the forehead because everybody gets these lines. Okay, I'm in my late 30s and I'm starting to get these lines. So what it would be good for me is to have a light dose along where the action catches the most lines and to smooth it out for a few months at a time. The other place that we commonly treat is called the crow's feet, and that's when you squint smile, you get little lines from here, kind of like rays out from a sun. And so when you weaken the muscles that do that, you don't get as many lines forming there. Okay. In terms of the brands that are available, we have Botox, which is kind of like Uber. Everybody knows Uber. But just like there are other rideshare companies, there are other neurotoxins. So one of them is Dysport, which was first made in the United Kingdom and is manufactured by Galderma, which is a subset of the Nestle company. There's a product called Xeomin, which is made in Germany by the company Mers. Gwyneth Paltrow is their spokeswoman currently. And out of Korea, there's a company called Evolus that makes a toxin called Jeuveau. Of these four, they are very, very similar in how they work. For some people, some of these toxins may set in a little faster and last a little longer. So Botox in general, from my experience, Botox itself has an effect of setting in about 3 to 5 days after the injection. So once the injection goes into the muscles that you want to make weaker and relax, then what happens over the next several days is that the treatment starts to work. And how you will notice it is that you can no longer do this as strongly or as forcefully as you used to. And you notice a change incrementally over the first several days until at some point you're no longer able to make this frown or raise these eyebrows to make the lines or catch your crow's feet at all. Overall, the effect takes about 2 weeks to settle in, and then you'll notice the full effect of the treatment that you received. That's why I always have, especially first-time patients, come back about 3 to 4 weeks after their first treatment to make sure that there's no other area that they want a little more treatment. So my approach to this is that you know the muscles of the upper face affect your eyebrow position. So when it comes to your eyebrow position, what you are looking for is a little bit higher position so that your eyes are brighter. So there's one muscle that moves your eyebrows up, and that's your forehead muscle, okay? Meanwhile, there's two groups of muscles that bring down your eyebrows. So those are the glabella muscles right here and the crow's feet muscles right here. So my tendency in terms of treatment is not just to look at the lines that you form with your facial expressions, but also to look at the brow position as you move your as you make your facial expressions. If your brows are already too low, I will tend not to treat your forehead at all, regardless of whether you have forehead lines, because if we make this muscle even weaker and relax it, then your eyebrow position would continue to get lower. Okay. So for the muscles that bring down your eyebrow, including the glabella and the crow's feet muscle, what I tend to do is treat those a little more aggressively so that this expression gets weaker and allows the brow to float up. That's what you call a chemical brow lift, which is a nice treatment, especially for people whose tails of their brows kind of run a little low. If you want a couple millimeters of a little bit of raise up here, a nice treatment right under the tail of the eyebrow will do you just great. Again, if you're joining us, I'm Dr. Kim. I'm coming from Fairfax, Virginia. We're at Dante Salon at the top of the hill in Old Town Fairfax. This is my office number. And to enter for a chance for a free toxin treatment, please text the word relax to the office number. Any and all requests will be honored. And if you've won in the past 3 months, sorry you're not eligible, but for everyone else, we'll draw randomly and call you in for a treatment if you win. So in terms of toxin to toxin, so Botox versus Dysport versus Xeomin versus Jeuveau, there have been some studies, scientific studies, that have compared, how fast the onset of action is, how long it lasts, things like that. I would say there's no, among the toxins, there's no one that is the best for everyone. So it's kind of like Uber, Lyft, Via, whatever rideshare companies you may know of. It kind of depends on the driver in terms of the overall satisfaction of your treatment. Whether your person is an Uber driver or a Lyft driver, it kind of depends on your driver in terms of your overall enjoyment of the experience, right? So similarly, I use multiple brands. And what I've seen over my experience with Botox, Dysport, Xeomin, especially those three, is that Botox sets in pretty reliably at starting about 3 days time, and the overall effect, sets in over the course of about 2 weeks. Now, for most younger people whose metabolism is a certain rate, the action of the muscles will start to come back around 10 to 12 weeks. And you're due for a treatment at about that 3-month mark. For Dysport, I like it especially for injecting along this chewing muscle. You might have seen me do that a few months ago on my Instagram Live, where I injected my own jawline with Neurotoxin to decrease my teeth clenching, my teeth grinding, and my TMJ issue. So Dysport, from my experience, it sets in a little faster, sometimes 2 to 3 days, and it can last a little longer if it's used for the right patient. What I've noticed also is that for people who have larger foreheads, I call them 5 heads, if you want to get a little more real estate with fewer injections at a low dose, Dysport sometimes, in my experience, spreads a little bit better than Botox or Xeomin. Now, if you've had Botox or Dysport for a while and you're like, the injector is giving me the same dose, same treatment, but it's not working as much anymore, Xeomin might be an option for you. So the difference between Xeomin and the other toxins is that in the bottle, and these all come, sterile, and you're supposed to refrigerate them or freeze them or whatever. In the bottle, there is no extra protein that is in the Xeomin bottle compared to the Dysport or Botox bottle. So their unique value is that there's no other proteins that are in the solution when you reconstitute it and when you inject it. So for people who develop a tolerance to Botox or Dysport, what people find often with Xeomin is that the product is more pure. So if you've had toxin for 10-15 years and you switch over to Xeomin, sometimes you get a nice effect. Okay, in terms of the nitty-gritties of the science, they all work the same way. They're very, very, very similar in their molecular structure, but it's just a matter of which one is the right fit for you. So on your first visit to me, when you have Botox with me for the very first time, I'll go over some of these details again with you, but I want to make sure that you have all the information and you feel very comfortable and informed before we undergo a procedure. Okay? Botox is one of the, quote, simpler things that I do, but again, a treatment that takes even a few minutes, just like neurotoxin injection, I want to make sure that you're comfortable where you're sitting and you're comfortable with me and the information I give you and what you would expect. In terms of the downtime after the injection procedure, it's very little. You might have a couple little welts along the injection sites, a little bit of pink due to the needle itself, but again, that goes away pretty quickly. And in terms of washing your face, taking care of your skin afterwards, there's no restrictions on that. I would probably advise not to exercise for the rest of that day. Exercise tomorrow, the day after is totally fine. But kind of just to work it in for the next, several hours after injection, just, do the motions that we would normally do and that we treated to try to relax those motions. And so you do this, a couple of these, and a couple of those. Just a couple times an hour over the next several hours after your treatment so that it works in nicely. There are some less common uses for neurotoxin, so anywhere that you would want to relax a muscle for benefit is a great choice. The other thing that it can be used for is to inhibit sweat glands. So the same signals that fire our muscles also fire our sweat glands. So some people even undergo toxin treatment for super sweaty armpits and also for super clammy hands. So that's a little more delicate of a procedure, but again, it's relatively quick in the office and you're back on the road in no time. The other muscles of the face and neck that you're able to treat include gummy smile muscles. So if you can do the Elvis lip like this, and it's really, really strong, and you have a big gummy smile that shows a lot of your upper gums when you smile, a quick shot right here and right here can relax your lip levator muscle to give you less gummy when you smile. Also, for some people, if the corners of your lips are too downturned, it might be because the tone of this frown muscle is too strong. And so if you inject this muscle to relax it, the corners of your mouth can turn up a little bit. If you have a orange or butt chin, like when you clench right here, we can relax that too. That's the mentalis muscle. And by injecting into this muscle, you can get less of that butt chin when you smile or when you have other facial expressions. Some of the other things, especially for younger people, if you have really tense neck muscles like here, some people have big cords of this muscle called the platysma muscle, and if you inject toxin along the edges of that muscle, it can relax it so that you have less of a cord-like look. Okay, I don't recommend this for people over a certain age because it's for people over like 45, 50, if you have cords here, it's not because there's too much tone of the muscle, it's actually because the muscle and the tissue over it have sagged. So if you put toxin into saggy tissue, it's going to make it worse. So it's good for young people like 25, 30, 35, that age range. But if it's because time and gravity have taken over and the neck muscles are saggy, I definitely would not recommend it. So at this point, if you're just joining us, Again, this is our office number. Please text the word relax to get your free, to have a chance to win a free treatment with me valued at $495. If there are any questions from the users, we can take a few.
Okay, the user asks, why does Botox freeze people, like some celebrities that I see?
So, few celebrities come to mind when I think of people whose faces are frozen. Okay, Nicole Kidman, she's a beautiful lady. You know, she's very tall, very pretty. When she smiles, her smile looks frozen, and that's usually the person I bring up when I talk about Botox and frozen people. It's because there's too much. The doses are too high, or they do it too often, but usually because the doses are too high in the wrong areas. So there are expressions that you really kind of want to get rid of, like this, okay? And most people, if they can't do this at all, they don't mind. They're okay with that. If you can't emote at all, it's because your Botox doses are too high. In terms of Botox units, I generally do about 15 to 20 units here. And for first-time people, I generally go like 4 or 5 units along the forehead. That's it. And then for the crow's feet lines, I generally do about, between the two sides, 6 to 8 units per side to start. Now, if you go higher than that and you relax the muscle too much, it's not relaxed anymore, it's just frozen. So when you try to smile, when you try to look surprised, you know, you want to have some of those expressions so that it looks more natural. But if your doses are too high, then you look frozen. So that's something to watch out for, definitely. And especially if there are other areas of the face where you make lines like bunny lines right here. If you don't get that treated and everything else is frozen, then it's kind of a giveaway. So if you don't want it to look that obvious, then yeah, you'd rather not be overdosed. And it's always better in my mind to underdose and come back for more rather than overdose and be frozen for 3 months. So that's why I start off with low doses for everyone.
Okay, another user asks, can lower Botox last longer than upper Botox?
So lower Botox, we're talking about the chewing muscle along the jawline. That's your masseter muscle, and pound for pound, it's one of the strongest in your body. For there, we use higher doses, number one, because it's a bigger muscle, and number two, because it's a stronger muscle. So in terms of Botox units, and I'll go into what I mean by Botox units in a little bit, I put 30 units here and 30 units here. Now for Botox in this area, I'll put a total of 30 units or so in most patients. Because it's a higher dose and because it's put into a single muscle, you have the potential for it to last longer. Now for me, when I inject myself, this lasts somewhere between 4 to 5 months based on the dose that I inject for myself. If you go with a higher dose, because you have more strength here and more bulging, then yes, there is a potential for treatment to go longer than 4 to 5 months. For some people, it can last 6, 7 to 8 months, depending on the person.
Okay. We don't seem to have any more questions.
Okay.
Any final words for our audience, Dr. Kim?
So I just wanted to go a little bit into what I meant by Botox units. So every toxin brand, except for Dysport, goes by a 100-unit bottle. So each bottle that your injector draws up for you, it contains 100 units. It's kind of like currency. You know, let's say a Botox bottle has $100. Dysport, let's say you're talking in euros or Canadian dollars or something. One bottle of Dysport has 300 units. Now, it's kind of like currency exchange, if you will. So if you travel to a different country, you know, $1 will get you X number of whatever currency of the country you go to. Let's say, you know, right now it's like $1 to 1.5 euros or whatever it is. It's kind of like that with Dysport. So the exchange rate, so to speak, between Botox and Xeomin and Jeuveau versus Dysport is 1 unit of theirs is equal to about 2.5 to 3 units of Dysport. So generally, we say, if you treat with 30 units of Botox here, or Xeomin or Jeuveau, you're probably treating about 85 to 90 units of Dysport. It's just kind of it's kind of an FYI. Every injector knows about this currency exchange and will treat you accordingly based on which toxin they use. So I use Botox, Dysport, Xeomin, and I think patients of all walks of life have really good results with all three. I would say that I have no financial interest in any of them, so I'm going to present them to you as unbiased in a manner as I can. But whenever you decide to come for your next treatment, we can certainly talk through as much as you like about which one you would like to go with and which one, depending on the situation, might be the most appropriate for you. So I think that's about it for today, unless there are any other questions that popped up recently. But again, this is our office number. Please text the word relax to the office number for your chance to win a free treatment. I'll be more than glad to take care of you, answer any questions you may have before treatment, and to walk you through the process of treatment and what to expect in the days and weeks ahead and how long it will last for. So if there are any suggestions about next month's Instagram Live, please text us to this text this number to that with that topic. And with that, I think we'll make it a Thursday evening, and hope to see you at the next live. Thank you for all your support. To all the patients who came to our Dysport party yesterday, a special thank you to you, and I look forward to seeing you again on our next live. All right, thank you very much. Have a great evening.